Good morning, everybody. Thank you, Professor S.K. Agarwal and Professor Shantanu Pandey to organize such a memorable and long-awaited meeting of surgeons. And I'm really thankful that you have given us the opportunity to share on a very important topic. That's the artificial intelligence, how it's being used in, we all know that it's being used in for cybercrime and various industries and all those things. But what is role in cardiovascular medicine? It's a new technology, and what are the barriers of implementing in not only in cardiology as a whole, in medical sciences, and what can be the possible solutions of being used this technology to best of our availability globally, not only in the urban population, but as well as in the rural populations, which is very important in our South Asian countries. So as we all know that cardiovascular disease is globally affects more than 500 million people worldwide due to substandard lifestyle, which led to a growing burden of non-communicable chronic diseases and a risk factor for cardiovascular disease. So to manage all those things, the World Heart Federation has recently in one of his global meeting has said that health system today face a fundamental challenges in delivering the optimal care. How one should provide at least optimal care, not only to the small countries, underdeveloped countries, but as well as to the urban and more so in the rural populations. What are the constraints? What are the barriers in their healthcare workforce? And to manage, you have to provide the quality, but then quality has a cost. So what are the financing availability and whether this technology can be affordable for use in cardiovascular medicine and how to deliver? That's a big challenge. As I said, digital health technology, such as electronic decisions, support tools, telemonitoring, remote monitoring, as we have seen in few of the centers in the country during COVID time, or mobile health apps have the potential to help address health system challenges, which limit the achievement of optimal and various challenges in the health system. So digital health intervention is a tool to reach sustainable, that's the aim, to deliver development targets and reduce premature mortality from the non-communicable diseases by a third by 2030. So that's a big challenge, but yes, people are aiming to achieve that. As we all know that this modern artificial intelligence has evolved from machine learning and deep learning. These are the two different parts, but they are connected. So machine learning is basically enables to improve the task which is being provided. The guidelines are there. The initial data is available. And the deep learning involves the algorithm development based on the vast input and how to achieve the output, how to achieve the maximal use of this technology on the convolutional neural network. So these are the two basic fundamentals of the artificial intelligence, both machine learning as well as deep learning. So in principle, this machine learning, one should understand that what it is, whether it is a unsupervised field subset or supervised. So a specific algorithm is selected and presented with the process data. The data is available, and there should be a training of the data with initial guess at solution. Data is tested and then refined and being used practically. So a training can be supervised or unsupervised depending upon the data available, what are the inputs and what we want to achieve that. So there are various benefits which we can see by the digital health intervention for cardiovascular diseases. One is the empowering the patients and the providers like us, hospitals, doctors. Secondly, to improve the long-term patients' outcomes. What are the results? What are the morbidity and mortality, which we can predict? What are the, how one should promote universally? These are the health services coverages. And then finally, to reduce the healthcare cost. That's very important, because every technology has a cost, which has a quality. So there are, one should understand what are the barriers, why we should use this artificial intelligence in our practice. So there are fundamental barriers which prevents the implementation and access to the digital health technology globally. So health system governance, that's a problem. The health issues are there. Patients and technological factors can prevent the implementation of this technology. So this can cause inequity in access to the digital technology and its potential benefits. So we will not expect too much of benefit initial. In initial, various trials have shown there are not much benefit, but it is an essential to acknowledge. One should understand that not all this technology to date have positivity impact outcomes. So the aim of World Heart, as I said earlier, the World Heart Federation has a roadmap, is to provide implementation frameworks, first of all, for local adaptation for prevention, detection, and early treatment strategy for cardiovascular diseases. And this World Heart Federation roadmap for digital health in cardiology, basic aim is to provide recommendation for overcoming all these problems. So as I said, there are several digital health interventions which have shown potential for cardiovascular management. So there are various text message providers, mobile health apps, telehealth, consultation, wearable devices, and electronic decision system. For example, if we are in our MICU, doctor is available, and there is a cross-reference from the other departments, and the person, the nursing staff is not available to that department. So if patient has a chest pain, for example, so he has a wearable device to attach to his monitor. So the chest pain is there. The patient will tell that I have a chest pain. So somebody has to look. So automatically that device, through that device, the ECG will go to the respective chest pain physician. For example, a cardiologist who is sitting in ICU. So he will see the ECG, he will monitor he will see the blood pressure, the pulse, saturation, everything on that. And then depending upon the diagnosis, he will tell this is the possible, without going physically to that patient, he will understand, make a diagnosis, and the moment he will put it, it automatically tells what is the treatment plan. So that is how this artificial intelligence being used. So as I said, there are various randomized control trial like Text Time showed that 4 semi-personalized messages sent automatically on the random time significantly improves the blood pressure, BMI, smoking cessation, physical activity monitoring for each and every individual cardiac patients, and adherence to the dietary guidelines. This HERB digital hypertension randomized control trial of 400 patients from 12 sites in Japan showed that an interactive smartphone app retrieving home blood pressure monitoring data to generate a personalized program for each patient, outpatient, already on hypertensive, already on the drugs, how to monitor its profile. So a person can automatically get into enrollment into this app form, and then these patients being followed by the consulting physicians. So these wearable devices used to support the cardiovascular management like physical activity, energy expenditure. And it's in 2019, there was a systemic review of 28 randomized controlled trial of around 4,000 patients. The second is the M-STOP randomized control trial, where demonstrated the home-based wearable continuous ECG monitoring of the patients, outpatients. Patch is successfully identified the atrial fibrillation in such patient. So first time the artificial intelligence being used in early diagnosis of atrial fibrillation and various arrhythmias and blood pressure monitoring. The Apple Heart study, we all know, demonstrated the moderate effectiveness of the Apple Watch in identifying people with atrial fibrillation, lone AF. The expert exercise prescription in everyday practice and rehabilitation training tool is an example of a clinical electronic decision support tool. So these are the few earlier studies being done 4 or 5 years back. But finally, the European Association of Preventive Cardiology introduced the expert study, which shown there is an interactive decisions which helps in enabling the healthcare professional to compare their exercise prescription to predetermine patient care using an algorithm. The recent prompt heart failure trial, and lastly, AI decision to support tools can aid in interpreting the medical imaging data automatically. So basically, then WHO, after these trials, recommend that the health content, the digital application, and then which helps in enabling environmental consisting of a national strategy. I'm coming to a subsequent slide. Reimbursement policies and a digital infrastructure, how it can be done, because this technology has a high cost. So as I said, this digital platform designed to deliver integrated, comprehensive, and continuous patient care. This Empower Heart works on two more principles. One is the technology, another is the task shifting, basically where non-availability of the physicians, both in urban and rural population globally. So this Empower Health system has a capability and various important features like mobile app for healthcare providers and a web-based dashboard server for healthcare administration. This clinical decision support system generates personalized management plan. That is very important because then it's become a personalized. So every individuals, when using all these devices, you can monitor everything as far as the cardiovascular system is required. So it maintains the longitudinal health records, generalized lifestyle recommendations, ability to work in offline mode, and real-time monitoring. That is the crux of this technology. So these are the barriers which I mentioned in the previous slide. So what are the solutions? How to overcome that? So one is the acceptability and feasibility of this technology. Second is the Empower platform. So the government of India, they started in a smaller state. The Department of Technology started into smallest states in Northeast, Tripura and Mizoram, and they adopted successfully the Empower Health, where more than 2 lakhs people have been benefited from this technology for this non-communicable chronic diseases. So the national guidelines was formed and a strategy was planned. Initially, there was a lack of national guidelines, how to use all over the country. So they started in these 2 states earlier. Then at the time of implementation of this Empower Health and no strategy for long term. So there's no long term, how one should go forward from initial planning to these 2 states. So as a result, the government of India recently initiated the Ayushman Bharat Digital Mission, which aims to provide the necessary framework and infrastructures, which we are well aware. At the same time, the WHO adopted the Empower platform to develop the MPAN app for managing cardiac diseases. So there are challenges. The consumer focused on the responsive and primary care integrated web application we call as a Connect. So it is a challenge to integrate the data and communicate with the people. And then how to do an intervention. Intervention means how to work on that data. So that is what the Connect web application being used for decision makings, and then prognosticate the disease further. So there are these are the benefits with the Connect app, where interoperability of the digital health intervention being noticed, and this is integrated with the electronic records. guide the research system. That is very important, because unless you know how this patient will behave, for example, artificial intelligence, for example, just see the retina of a person can predict that this person, maybe after down the line 30 years, will develop blood pressure. What should be his approximate BMI? What should be his blood pressure? What should should be the blood sugar level? So all these risk factors you can predict. So predicting a cardiovascular events is a major challenge globally. For example, in coronary artery disease, we know that these are the plaque and that this ruptures and blocks the artery. But those plaques which are mild, stable, how much time it will take to rupture, it's a challenge. If you can predict that this plaque will rupture down the line after 15 years, so that is what we are looking at, and we have no answer right now. So, and the challenges for the rural population where the monitoring system is not there, the nursing staff is a challenge, the providers, the consultants are not available. So these are the challenges for for us. So probably the artificial intelligence, this group, this technology can be used much better way, and it involves the three key pillars like clinical expertise, the coordinating the transmission, and then interventions. What should be the drug composition for that individual patients, and then the cost, which is very important, from where the cost. So all these guidelines the government of India has to look. So what is the solutions? So which work in a low bandwidth. So this technology works with the low bandwidth. So that's a benefit with the being used in the rural population. So that is very important. And this help to achieve scalable and sustainable rural telemedicine programs. As I said earlier in my previous slides, there are barriers, there are solutions to implement digital health intervention based on the WHO model. So I'm not going into the detail of these WHO models. We are well aware how it works. But the problem with these barriers, what is the solutions? The most important is the lack of national guidelines as of now. So what is the solution? So one has to establish the national or regional e-health guidelines and strategy. There are poor involvement of the critical national stakeholders, inclusive the engagement with the policymakers and representative of the patient, practitioners, industry and civil society. There are problems with the legislation, how to make a policy, how to implement it, which is medico-legally correct. And what are the strategy and investments? It is still unclear how to use the proper, how to know the proper costing of this technology, how best we can use it. So it includes a long-term investment strategy as part of the national guidelines regarding artificial intelligence. The other is the intervention which is not adopted to the local context. So one should overcome to this problem is to perform a structured and a holistic needs and context assessment before designing and implementing the interventions. Then comes the role of infrastructure. Unless you have infrastructures, you cannot use this technology. And then standards, one has to maintain it. And then how to interpret all these data. So there is a national and international differences in the data collection, storage, and the definition is definite standards. One should promote collectively definition and data storage formats and emphasize the implementation of open data platforms. So unless we have a data, you cannot feed into these tools, and then one cannot use this technology for cardiovascular problems. And then the health workforce, which is a challenge globally. Manpower is a challenge. Training is a challenge. So lack of perceived effectiveness and use of digital health intervention, inclusive technology, design, and education of the use. And then come the patient. Sometimes patient needs us at the bedside to talk to them, to listen to them, to overcome their problems. So that is still a challenge for most of us for using this technology. But there are positive side also. There are barriers, there are solutions. So this technology being used very much in arrhythmias, LV dysfunctions. We'll know there is a data. You can use this technology into that, and detection of cardiomyopathy with a special focus on tissue imaging, detection of electrolyte imbalance, serum drug levels in a cardiogenic shock patients. We know the levels, what it can be. Then wearable and mobile technology in cardiac rhythm disorders. That is the most important, and initially most of the randomized controlled trial studies such patients. So these are the few of the places. They are very small segment of patients, but then definitely in such situation, these being successfully is working. In India, is still far behind the developed nations. There are Indian Institute of Science, we all know, contributes the most. Recently, the guidelines for artificial intelligence research-based clinical trials in this process, but there are challenges: accountability and responsibility for decision-making, clinician-patient relationship at risk, that's the most important, bias related to developer, patient safety at risk, ethical conundrums, may require new trainees, risk of commercialization is there, always it is there. So to implement the artificial intelligence into clinical practice, one should, data acquisition is a challenge, then interpretation and reporting is a problem. So continuous exposure to new data is important, one should learn it. Finally, the question of how algorithms are practically deployed across institutes and countries remains to be determined. So not only in India, the neighboring countries, underdeveloped countries can connect through this technology very quickly. So one should adopt and understand the data into this technology, and which finally helps in our decision making and patient outcome. So whether algorithms should be individually supplied to the individual institutes or enabled is a challenge. Who should control the data is a challenge. And I'll tell you a few of the examples, like in coronary artery disease. This algorithm can assist with patient safety and improve the diagnostic accuracy during the coronary angiogram. Then also you can see in electrophysiology, these ECG sensors are there, and there is an algorithm over inside is being there, which helps in, which is non-invasively and can be easily accessed. And finally, these MRI images can be analyzed right at the patient's by this artificial intelligence very accurately. So if you can see, this diagram depicts the AI ECG as a platform from remote monitoring, where patients can't come to your place. So far left is the multiple form factors have been used to collect the ECG, and then this technology via cellular technology to a cloud for AI processing system can be seen, and the general and then you can connect to the patient directly and alert in the event of these abnormalities. This is the one of the other examples where top level where you can see the ECG, and lower where the rhythm and the continuous rhythm monitoring is there. By seeing is you can still see patients of atrial fibrillation which are missed, and still they said where a routine ECG cannot find this arrhythmias. By this technology, you can very accurately connect and tell that these patients may have cardiomyopathy, and this cardiomyopathy may not respond to the drugs because of the fibrosis and irreversible changes. So this technology predicts and tells that this patient will not improve. That's very important. Predicting a cardiovascular events, a post-graft patients, whether that graft will work after 5 years or not, maybe this technology will tell you better. So as I said earlier, if you can use this, you can predict the cardiovascular risk factors, that this can happen in future down the line, in the families, in the siblings, you can very well predict. So, but there are limitations. One should understand that despite the immense promises of the machine learning, a number of considerations have its development and require addressing. Data ownership is a problem. There is currently a lack of well-established quality standard and a centralized for this newer technology. Lastly, the physician's engagement and thoughtful assessment of workflow and implementation are essential for the adaptation of AI tools in clinical practice. So one should be very careful. Attention will be essential to permit AI to improve clinical practice. So there are limitations as of now globally. So to conclude this topic, the digital health intervention is help in cardiovascular disease management, prevention, and empower patient in a more efficient care. There is a need for collective action involving patients, healthcare providers, government machinery, industry people, regulators, and reimbursement authorities and policymakers to identify and help and solve the context-specific barriers. This roadmap provided potential solutions for frequently encountered obstacles, barriers, and find out the solutions. Artificial intelligence can play a critical role in better decision-making, hold promises for the future. The physician and trainees need to be taught how to use this technology to best way in their specialty. And many algorithms will be integrated into devices used by the clinician. So gradually, I feel that maybe down the line, after 5-10 years, this technology will come and we can be used very well. So this is unlikely to replace the physician. That's the most important. You can't replace the physician. Today, somebody WhatsApped me that there is a news going on, a lady is speaking, but it was artificial intelligence created. I have in my WhatsApp. Actually, that lady is not sitting into that center where the news is being telecasted. So by artificial intelligence, you can create Dr. Tiwari speaking right here, but I'm not physically available here. So that is one of the tools, but then you can't connect to your patient and to your audience. So it requires proper testing, validation, and prospective assessment, as well as a compassionate and caring clinician to deploy, apply, interpret his finding to help the human seeking care. Thank you very much.